proteins works, that can be sort of difficult to predict what's going to happen. They can, different changes don't always add up. You know, you've got one bad mutation, another bad mutation, another bad mutation doesn't always add up to +3 badness, right? You have to see how they all work together. And so it's really going to depend on how this interacts with our human behavior and how it interacts with our immunity, both vaccine related and natural immunity, and then hybrid immunity for the people that have had both vaccine and COVID. And right now, what we know is that Delta has been the biggest thug of all COVID variants. It is the one that has been basically taking over everywhere it's introduced. And what we're waiting to see is if Omicron is going to be able to encroach on Delta's territory. Is it going to come in and take over where Delta is already spreading? The other variants that have had issues with vaccine-related immunity that have been sort of a concern for us that the vaccines may not work as well have not been very good at taking over where Delta is firmly entrenched. Now, Omicron seems like it might be different.
And just real quick, I want to reintroduce what we're doing here because we might have been cut off at the beginning, but this is my Doc to Doc series where I talk to experts around the world about things pandemic. And right now with me, Dr. Emily Landon. She is the medical specialist for the High Consequence Pathogen Preparedness Program and also the Executive Medical Director for the University of Chicago Medicine. And we're talking about the pandemic. We're talking about Omicron, the variant that's out there. You mentioned Delta being the dominant variant. Just very briefly, how do these variants compete with each other? Because we heard that Delta overtook Alpha, and now the concern is, will Omicron overtake Delta? How does that work in the real world?
Yeah, so honestly, when it comes to COVID, it seems like the fastest is winning out. So the variant that is most likely to infect people at a lower dose and make them sick faster is the one that is getting the win, so to speak. And when a new variant is introduced, like Alpha was more contagious, in other words, it can spread, you can catch it with a lower dose of infectious agent, and it can make you sick a little faster. So that came along first after the original COVID, and it was like, get out of the way, regular COVID. I am faster than you, and I am better at spreading to people. So that was number one. Then Delta was even faster and better than Alpha, and it came through and it took over where Alpha was. And now we're seeing that Omicron is doing that in some places in South Africa. Whether or not it's going to do that everywhere really remains to be seen. We're not going to know until it's introduced into different communities, which it obviously has been, and has a chance to do its thing, and we'll see what happens.
And one of the big concerns is that, they talk about those 30 plus mutations on the spike protein, the spike protein, I have my little model here, the spike protein that comes off of here that attaches the virus to the cell wall. There's 1,273 amino acids in that. 30 of those, maybe a little bit more, have changed these mutations. And we know that individually, some of those mutations could be more dangerous, could be more transmissible. But what we don't know is the constellation of them, what all of them together do. Is that correct?
Yeah, that's exactly right. So imagine that the game that this virus plays to attach to your cells inside your lungs is very similar, although far more complicated than those little toys that kids have where they have to put the star in the star hole and the square in the square hole and the round in the round hole, right? And the spike protein has a specific geometry and a specific little pocket in it that fits right on your ACE2 receptor. And the better that fit, the more likely it is to land and fit no matter which direction it comes from, the better that virus is going to be at getting into your cells. And we know that a number of the mutations that we're seeing in Omicron have been seen in other versions of the coronavirus that make it even better at landing in that site than the original coronavirus was. The question, as you point out, Dr. John, is when you add up that many mutations at once, is it really going to fit, or are some of the other mutations on the outside going to pull it in a way that doesn't make it work as well? The preliminary indicators, though, from South Africa look like, unfortunately, a lot of these things are coming together to be pretty nasty.
All right, we'll keep our fingers crossed that it doesn't get much worse than what we are hoping, we're at least thinking at this point. But one of the ways to try and keep it under control, President Biden just announced some new plans out to try and keep this under control, including some travel plans, at-home testing, starting with that and reimbursing through insurance reimbursements for at-home testing, and really ramping those types of things up. What else should be done?
Well, I'll say this. The most important thing to remember here is the layered approach that we use when we help try and prevent viruses from spreading in hospitals, or when we originally had to start working with COVID. There are multiple things we can do. We don't have to rely on just one thing to fix this problem, and we shouldn't rely on just one thing. So vaccines are effective. Vaccines are not an on-off black and white switch, right? They're not like all 100% effective or they don't work at all. So original COVID, the vaccines are really nearly 100% effective at preventing. Alpha, maybe a little bit less. Delta, a little bit less. And this one looks like it's going to be a little bit less, but we don't know how much less. But that doesn't mean you shouldn't get one, because even if it's only 50% effective, that's a big, big reduction compared to being fully susceptible. So get vaccinated and get your booster if you haven't had one, because more antibodies will be better. If only some of those antibodies are able to attach to this particular spike protein, you're going to want more of all of them, because we don't know exactly which ones are the right ones yet, and we don't have an Omicron specific vaccine. So that's number one, vaccine. Second thing is, you've got to keep your mask on. The fewer contacts that each of us has with other people, the less opportunity there is for the virus to spread. And that's what we're looking to reduce. We want to cut down the spread, because the fewer cases there are in the community, the less likely it is that you're going to get it. And so even if masks aren't 100% all the time, they really will make a difference if we just keep them on. So keeping the mask mandate has got to stick around. Then
let me ask you.
Yeah, go ahead.
Let me just real quick ask you about this, because this is almost a tale of two countries. I just, for work purposes, went to Latvia and Spain over the last few months. Latvia, low vaccination rates, mask mandates. Spain, high vaccination rates and mask mandates. And there's a complete difference in the case numbers. Latvia case numbers took off. Spain case numbers have been pretty nominal, or at least steady. My theory is that it's those high vaccination rates along with the mask mandates that are keeping cases under controls in situations like that. Is that a far off theory, or is that something?
No, Dr. John, you're totally right. So far, mask mandate or masks plus vaccine has been largely unbeatable. When you have that happening, things look pretty good in most communities. Now, coming inside in the winter, and I think there's also an issue with Latvia and Spain with the difference in the climate.
The temperatures, right?
Yeah. And being indoors is like, when you put a drop of food coloring into a drinking glass, you can see that drop of food coloring right away. You put that same drop of food coloring into a bathtub or a swimming pool, and you can't see it anymore. And the same thing happens with COVID. It gets diluted by all the air outdoors, but it sort of sticks around and can be more infectious when it's indoors. And when it's colder, like it is in Latvia and here, even masks and vaccine may not be enough. And Omicron is going to put even more pressure on that. So you have to keep your contact lists smaller. So we all need to have some up close and unmasked contacts, right? We want to spend time with our family for the holidays. We want to be able to hang out with some of our closest friends and your family that you live with. You're not going to wear a mask all the time around them. And so, you need to wear a mask at other times to make it possible and less risky for you to be unmasked at the times when it really matters.
Now, looking at treatments here, COVID Merck and Pfizer both have announced antiviral medications, and some of the results from that. Are you hopeful that those will actually help?
Yeah, I think that they're going to be a little bit too late for Omicron, unfortunately. They may have come at the tail end of this, and it's not clear how effective they'll be. I think they'll probably still retain some of their effectiveness, but we don't have all the data about these. So yesterday, Merck presented its data or 2 days ago, Merck presented its data about molnupiravir to the FDA, and the early results from the trial were really, really promising, but the second half of the trial was a little bit less promising. It's not that this is what happens sometimes in trials. There's a reason we test it on lots of people and do it over a longer period of time, because sometimes stuff can look great, and then, when you do more people, it's not as good, or it can not look great, and then you do it in more people and it's much better. So in this case, it looks a little bit less promising, and like there may have been some side effects. Now, that still may be worth it, especially for immunocompromised individuals early on in treatment, because anything you can do to help keep them safe, since the vaccines are not working as well on them, that's going to be the right target group to use those. The Paxlovid, which is the drug from Pfizer, looks a little bit more promising from the data, but the only data we have is really a press release. I'd like to see the real science data first. And hopefully those will be real game changers for us, because having an oral medicine that helps keep people in the hospital would be great. But they're going to be in limited supply in the beginning. So not everybody's going to be able to get them. Monoclonal antibodies still out there, still working, really very good. We'll need tweaks in order to work as well against Omicron, probably. But those tweaks are underway, and hopefully those can be pushed through pretty quickly so that we can have Omicron-specific monoclonal antibodies available.
But this gives us another tool in our toolbox. Like you mentioned, we have the
Yeah.
monoclonal antibodies, we have the Regenerons of the world. Now the Pfizer and Merck are adding these antivirals. So even though not one thing works as well as we'd like it to, the cumulative part of those hopefully will work better.
It's a layered approach. That's everything. The treatment, the prevention, all of it's a layered approach. And we shouldn't rely solely on treatments, and we shouldn't rely solely on preventions. You know, we need to do both. And we need to do whatever is reasonable, but allows us to keep most of our life going. But we have to be a little bit, we have to sacrifice a little bit. I mean, you may not be able to be barefaced at the grocery store for a little while, but honestly, that's not a huge sacrifice to make for the prevention that it gets you. And so I think a lot of people really don't like that, but it is, you know, it's totally worth it if we all do it. And masks are not something that you can just wear for yourself. You've got to, everybody needs to be doing it. They're much more effective when you're wearing them to protect other people than they are to protect just you. If you're relying on a mask to just protect yourself, you also need to protect your eyes. You need a stronger mask, a lot of things involved.
Now you brought up talking about masks going indoors, especially with the holiday seasons coming up. What should people be doing this holiday season? At what point should they consider changing their plans? If cases all of a sudden start taking off, if we start having another surge, if we start hearing more about Omicron, or at what point should people start thinking, you know, maybe I need to pull back a little bit?
That point is going to be different for each family, and it should be. So people who are fully vaccinated, who have received their boosters, probably are going to be able to hang out with their families and do the things that they're planning to do for Christmas. Now, that said, you may need to take some steps in the days leading up to those gatherings in order to make them a little bit safer. For example, if you're having a multi-generational gathering with people who are more vulnerable, you may want to avoid contact with other people, like sort of not be going out to bars in the week leading up to that gathering. You may want to skip, a cocktail hour at work in order to be able to be safer when you go visit your family. I'm giving you permission to do that. And then the other thing is you can make use of these tests. And this is something Biden mentioned today that's really important. So antigen tests, you want to talk about the rapid tests that people use? So the PCR.
Definitely, yeah, let's talk, because one of the theories that people are talking about, and that I've talked about over the last couple of weeks, is, you know, if you want to test people at your doorstep, why not?
I think you should do it. So these rapid antigen tests are limited in what they can tell you in general. And I want to talk about their limitations first. If you're sick and you use a rapid antigen test and it says you don't have COVID, that's not good enough. The test when it's negative and you're symptomatic is not good enough. You might still have COVID. You should probably either test again and go get a PCR test. But if you're trying to see if somebody is going to be contagious at your event, a negative test from one of these is good. Now, they have a really short expiration time frame, and this is what you got to remember. If you're negative in the morning, that's like a 6 to 12 hour time frame that you're probably going to remain negative, but it really doesn't tell you much about tomorrow, because these tests only detect sort of a narrow window of virus amounts that you could have in you, and it might miss some people. So it's not perfect. You don't want to use this to go and have, sing carols with your unvaccinated stem cell recipient 80-year-old grandmother. Like you need to do more than just have one negative antigen test in that scenario. But you can add a negative antigen test to a number of other things to make that work for your family. But you have to think it through. That said, a negative antigen test at the beginning of a gathering or right before a gathering it does reduce the likelihood that somebody has COVID and is going to be able to spread it.
Now, would you ask the question about, are you vaccinated?
Yeah, I would not. My mom is having some people over from she's a philanthropic organization that she's part of, and she's going to have 7 of her friends or 10 of her friends come over for Christmas cookies and coffee. And she said, well, can I do this? And I said, well, you can do it if it's in the next week, because we don't have a ton of Omicron yet. And so we know that the vaccines are going to hold up in that situation. It's unlikely. I would ask people who may have traveled to other countries to not be to sit this one out or wear a mask when they come to the event. I would also ask that people not attend the event if they aren't boosted. So they need to have been vaccinated within the last 6 months or have had a booster since then. And that is the first time that I really started saying you really shouldn't be doing stuff without a booster. But I think that's going to be becoming more and more common. I also told her to remind people not to come if they're sick, and that anybody is welcome to come and wear a mask the entire time, but that only people who've been boosted should take their mask off and have cookies. The rest can take them home and eat them later.
Now, the question I'm starting to get here, and this is what we'll end with. I always end with the question of, what do people have to look forward to here, and some hopefully motivational words you might have. But before that, this is a big question I'm starting to get now. Do you think this pandemic will end in 2022?
I think that calling an end to a pandemic is hard, right? It's easy to see when it starts. It's hard to know when it's over. I think there's a couple ways that we could get out of this. And one of the ways is a possibility with Omicron, right? So we could slowly transition to a situation where COVID is circulating more seasonally, and we have more community-based immunity and more hybrid immunity, more heterogeneous immunity, because we've gotten multiple different kinds of boosters and different vaccinations, and people have had some COVIDs and not been very sick from them. And that can make COVID much less of a threat to our society, to our economy, to our lives, all that. And that's going to feel like the end of the pandemic. But that's a long way away, probably still. The other option is that COVID mutates to a degree that it becomes no longer super dangerous. It accumulates enough mutations that it is so transmissible, and it may not even be susceptible to our vaccines, but it only causes that it's not able to really cause serious disease anymore. It trades its mortality and morbidity for transmissibility, and we end up with a virus that is super transmissible, replaces all of the old COVIDs, but doesn't make anybody very sick, and becomes just a common cold that you get once in a while. That would be awesome. Maybe Omicron will be like that. I'm not seeing that yet, but we have to wait and see what happens. But that would be a way out of the pandemic that would be really almost at this point, I would welcome that to be done with this. I think everyone would.
Yeah, and I think you're right. And again, thank you for your time. This has been wonderful. But what message do you have for people here? And hopefully a message, we're coming towards the end of the year or holiday season. You give people some hope.
Yeah, we have been through a lot as human beings. Look at everything that we've been able to accomplish. Look at the world that we live in. I know it feels like things are very different than the way that they were pre-COVID, but we're not going back to pre-COVID. There are a lot of things that have changed. And one of those, I think, and the one thing that I think we need to have in order to get past this pandemic, at least emotionally and mentally, and to feel better about it, is we need to realize we're not in this alone. None of us, no country is in this alone. No human being is in this alone. We have to rely on our neighbors. We have to rely on our friends. We have to rely on our families. We have to rely on the rival high school. We have to rely on the book club. We have to rely on Canada, Mexico, South Africa. We all have to be together in this, because if one of us is too susceptible, too vulnerable, too weak, that's when we're all going to feel the pain of that. And so the faster and the better that we can recognize that we can't just do it on our own. We have to really work to protect one another, which is honestly what the holiday season is all about, right? Coming together in community and enjoying those times with our family and our friends. And the way that we can do that is by respecting them and understanding that we have to love our neighbor.
You could not have said it better myself. Thank you very much, Emily. This has been a fantastic conversation. And again, this is Dr. Emily Landon. She is the Executive Medical Director of Infection Prevention and Control at the University of Chicago Medicine. And she's also the medical specialist, and I love this title, for the High Consequence Pathogen Preparedness Program. Emily, thank you very much, and hope you have a happy holiday.
Thanks, Dr. John. See you soon.